For generations, polio cast a long shadow of fear across the globe. This debilitating disease could paralyze its victims, often children, in a matter of hours. The virus left many with lifelong disabilities, and for some, it was a death sentence. The fear was palpable, particularly during the outbreaks of the mid-20th century. Images of children in iron lungs became seared into the collective memory. Polio attacked the most vulnerable, leaving families devastated. The lack of effective treatment options only amplified the terror. This invisible enemy, lurking in contaminated water and food, defined a generation's fear. Parents lived in dread of their children contracting the virus. The fight against polio was long and arduous, marked by scientific breakthroughs. The development of the polio vaccine in the 1950s was a turning point. Polio, short for poliomyelitis, is not caused by a bacteria or a parasite. It is caused by a virus, a tiny infectious agent that invades cells and takes over their machinery to replicate itself. This particular virus, belonging to the enterovirus family, specifically targets the nervous system. This is where the real danger lies. The nervous system, a complex network of nerves carrying signals throughout the body, is the command center for everything we do. It controls our muscles, our senses, and even our automatic functions like breathing. When the polio virus invades nerve cells, it can disrupt these critical signals. While anyone can contract polio, children under the age of 5 are the most susceptible. This vulnerability stems from their developing immune systems, still learning to identify and fight off infections. Polio is a highly contagious disease, spreading easily through person-to-person contact and contaminated environments. This ease of transmission, coupled with the virus's predilection for young children, underscores the importance of widespread vaccination. Polio is often described as a disease of varying degrees. Most people infected with the virus won't even know it. They might experience mild flu-like symptoms such as fever, sore throat, headache, fatigue, or nausea. These symptoms typically last a few days and resolve on their own, leaving no lasting effects. However, in a small percentage of cases, the virus launches a much more aggressive attack. In these cases, the virus invades the central nervous system, leading to more severe symptoms. Patients may experience stiff neck, muscle weakness, or paralysis. Paralysis, the most feared complication of polio, occurs when the virus damages the nerve cells responsible for controlling muscle movement. This can lead to temporary or permanent disability, affecting a single limb or multiple limbs. The severity of paralysis can vary greatly. Some individuals may experience weakness in a single limb, while others may lose the ability to walk or even breathe on their own. In the most severe cases, paralysis of the respiratory muscles can be fatal. The silent spread how polio travels. The virus enters the body through the mouth, often via contaminated food or water. This is common in areas with poor sanitation and limited clean water. The virus multiplies in the intestines and is shed in feces. This makes polio highly contagious. It spreads through person-to-person contact, especially in crowded conditions. Direct contact with infected feces or contaminated objects spreads the virus. Infected individuals can spread the virus even without symptoms. This asymptomatic transmission complicates control efforts. Vaccination is crucial to prevent the spread. Herd immunity protects even those not vaccinated. Fighting the incurable supportive care for polio patients. The unfortunate reality of polio is that there is no cure. Once the virus has invaded the nervous system and caused damage, there is no way to reverse it. However, this does not mean that nothing can be done. Supportive care is essential to manage the symptoms of polio and improve quality of life for those affected. Treatment for polio focuses on alleviating symptoms and providing supportive care. Pain management is crucial, as muscle weakness and paralysis can cause significant discomfort. Physical therapy plays a vital role in helping patients maintain muscle function and mobility. Assistive devices such as braces, crutches, or wheelchairs may be necessary to aid in mobility and independence. In cases of respiratory paralysis, mechanical ventilation may be required to assist breathing. This involves using a machine to breathe for the patient, allowing their lungs to rest and recover. Long-term care for polio survivors often involves managing the late effects of the disease, such as muscle weakness, fatigue, and pain. The shield of prevention vaccination, our most powerful weapon. The development of the polio vaccine stands as one of the greatest triumphs in medical history. This groundbreaking discovery has saved countless lives and spared even more from the debilitating effects of polio. The polio vaccine works by introducing a weakened or inactivated form of the virus into the body. This exposure triggers an immune response without causing the disease itself. The immune system then creates antibodies specifically designed to fight off the polio virus. These antibodies provide long-lasting protection, effectively preventing infection if the person encounters the wild polio virus in the future. The global effort to eradicate polio is a testament to the power of vaccination. Through widespread vaccination campaigns, particularly in endemic countries, we have witnessed a dramatic reduction in polio cases worldwide. The World Health Organization estimates that polio cases have decreased by over 99% since 1988. This incredible progress brings us closer than ever to a world free from polio.